All right, thank you so much, Matt. Well, knowing about your health is crucial in your well-being, and here to share more about women's health is Dr. Herrera from Summit Medical Group. Welcome to the show.
Thank you so much for having me.
Of course.
Yeah.
So talk about this preventative care plan, especially for women. It's so incredibly important.
Sure. So usually when you come into office, I'll talk about what is a preventative visit. Oftentimes we'll confuse that, with an annual wellness or a physical, and those are the exact same things. So when your doctor says, hey, it's time for your physical, that means it's time for a preventative visit. So in general, when you come and see me, I'll come in and I'll talk about screeners. Those screeners can be based off of your age, your gender, your current medical conditions, and your family history. And the reason why these screeners are so important is they help us prevent disease and start treatment earlier.
Right, absolutely. What are some of those health issues that you see really common in women? Some of us have no idea they even exist, like back in our families, have no idea.
Absolutely. So usually what I try to do is I start from top and go all the way down to your feet. So if you were to come into the office for me, one of the first things that we may do is a screener. Oftentimes in life we have underlying stresses or anxieties, and your primary care physician may be the first to identify anxiety or depression.
Yes.
Next, we talk about cardiovascular disease. Females, 1 in 3 females suffer from cardiovascular disease, and that's quite a bit. So when you come into the office, we can talk about blood draws or other screeners where we can look if your cholesterol is high or if you're developing diabetes to lower your risk of cardiovascular disease.
Interesting.
Next, whenever we see each other, we'll talk about breast cancer prevention. So mammograms start at age 40, and they may start even sooner pending your family history. So if you or your loved one have had breast cancer, then we'll often start them 10 years earlier.
Right, absolutely.
We move down, next would be colonoscopy, and our most recent guidelines have changed there. So previously we started at age 50, and now colonoscopies, male or women, start at age 45.
That's huge.
Yeah. We can't forget pap smears, which start at age 21, and then we go to bones, which is osteoporosis and the prevention of osteoporosis. And those screeners start with a DEXA scan at age 65.
Right, absolutely.
Yeah.
I love that. I love how in tune you are with the whole being care, especially in women. And you mentioned a little bit anxiety and depression, and I feel like mental health is something, we're thinking, okay, I'm checking all my boxes, but how can I take care of my mental health as well with my primary care physician?
Absolutely. I think that's huge. When we look at having a balanced, healthy lifestyle, I break it down into 3 components. Number 1, your emotional health. If we're trying to maintain our weight, or if we're trying to maintain just like I said, a healthy lifestyle, we need to be emotionally and mentally intact as well.
Right. Yeah.
So looking at that and having, the ability to identify in your primary care office is huge.
Right.
Also for a healthy lifestyle, of course, is, your physical activity, which plays a role into your mental health as well.
Absolutely.
And then your diet too. So it's a balance, right?
Absolutely. What word of advice would you have for women? I think we talked about it beforehand.
Sure.
You're always filling up everybody else's cup, and it's hard to get yourself in the office or whatever it might be, appointments for yourself. What word of advice would you have for women that are making doctor's appointments for everybody else but themselves right now?
Absolutely. I would say choose today. As a primary care physician, I want nothing more for my patients, for the people of East Tennessee, to be healthy. And so it's really important to call your local primary care physician and get scheduled. Whenever I see you, I will set a preventative plan and make sure that I'm creating a treatment plan that's right for you and your family. So it's never too late to be healthy. And like I said, today's the day. If you get the urge, call and schedule. We want what's best for you.
Absolutely. And real quick, where can people find you all online and get in touch with you?
Absolutely. So I'm at Norwood Family Medicine. We would love to have you. We have a great group of clerical and clinical staff. I believe our number will be up on the screen after. And then Summit has 85 practices and locations now.
That's awesome.
So you can visit us at summitmedicalgroup.com.
Right. Well, thank you so much for joining us today. And all of this
Absolutely.
knowledge on women's health, it's so profound, and it's so empowering to have someone on your side. So thank you so much.
Absolutely.
Absolutely. All right, guys. Well, coming up later in the show, I joined